Hello everyone, we are from the Immersive Reality Lab at National University of Singapore. We are here to present our paper, Facilitating Virtual Reality Integration in Medical Education, a case study of acceptability and learning impact in childbirth delivery training. Advancements in virtual reality technology have opened new frontiers in medical education, igniting interest among medical educators to incorporate it into mainstream curriculum, complementing traditional training modalities such as mannequin training. Our team has designed and developed a VR simulator for normal vaginal delivery in close collaboration with the Obstetric and Gynecology Department. We conducted a large-scale empirical study with 117 medical students, revealing a significant 24.9% improvement in knowledge scores when using VR as compared to mannequin. However, VR received significantly lower self-reported feasibility scores, indicating low acceptance to this new technology among medical students. We further conducted a qualitative assessment through in-depth interviews with medical instructors and students, providing insights into this discrepancy between learning outcomes and user acceptance. What inspired us to develop the VR simulation and conduct the study? Nowadays, there are challenges in securing OMG training opportunities, which include patient acceptability, gender bias, and physician reluctance towards students' involvement in the delivery suits. To make up for this declining clinical opportunities, mannequin simulations were conducted to serve as a complementary to the traditional apprenticeship model. However, running the simulation sessions requires space, equipment, and significant time investment from the medical professionals, who are already occupied with their regular clinical duties. Due to these constraints, not every student has the opportunity to actually perform the hands-on practice on the mannequin and receive guidance from the professionals. Students who also exhibit varying levels of engagement with the constructed scenarios and invest differing degrees of effort in their participation. Virtual reality simulation starts playing its role in various medical simulation training scenarios. While some studies have shown the positive gain in knowledge and self-confidence after the VR session, some studies shown that enjoyment of VR does not always correlate with improved knowledge. Thus, we formulated our overarching research question: how does the incorporation of virtual reality in medical training, particularly in training for childbirth delivery, influence both learning outcomes and the acceptance of the technology among medical students? This gives rise to three sub-research questions. How does the VR simulator affect the learning outcomes in terms of knowledge and problem-solving skills in childbirth scenarios? How acceptable is the VR simulator among medical students as an educational tool for childbirth training? What is the relationship between the perceived acceptability and the effectiveness of the VR and mannequin simulators in enhancing learning outcomes? Guided by the Director for Undergraduate Education for the OMG clerkship, who also teaches medical students during their normal vaginal delivery mannequin session, we designed the VR simulator to walk students through the second stage and third stage of labor, utilizing medical instruments and perform hand maneuvers. We then conducted a large-scale assessment of knowledge gains and user experience with 117 Year 4 medical students who were in their first week of the OMG clerkship. All participants began with a pre-simulation knowledge quiz, followed by their first simulation session using either mannequin or VR training. After completing a post-simulation quiz and feasibility questionnaire, they switched to the second simulation session with the alternate training method. The study concluded with a final questionnaire and feedback session. The measure for knowledge gain which is the knowledge quiz, was administered before and after their first training session only. It contains 10 questions with a maximum score of 100. It is designed to evaluate students' understanding of the second and third stage of labor based on Year 4 medical school syllabus. Our result is statistically significant and shows that the knowledge gained from VR simulation sessions was 24.9% higher than from mannequin simulation sessions. Subsequently, we used a within-subject analysis to compare the feasibility ratings of the both sessions. We analyzed students' ratings based on the feasibility questionnaire comprising 14 questions. These 14 questions can be further grouped into 6 feasibility domains: learning, confidence, feedback, usability, enjoyment, and presence. To our surprise, despite higher knowledge gain, VR training received significantly lower ratings compared to mannequin training in 5 feasibility domains: confidence, feedback, usability, enjoyment, and presence. These results can also be reflected in the students' choice of their preferred mode of instruction. More than half of the students prefer having the mannequin training only, and the VR training is the least favored on its own. However, there are still 42% of the students who would like to have both mannequin training and the VR training as a combined approach. From the students' comment on why they favored the mannequin training, the top 2 reasons given were tactility and engaging tutor. But in fact, fewer than half of the students were able to practice on the mannequin, and most of them remained to be the observer. The unequal opportunity for hands-on practice was also reported as a drawback of the mannequin session. To further understand the importance of instructor engagement and tactile realism, we conducted interviews with 3 medical experts and a few selected medical students. As reflected in the lower feedback rating, the majority of the students were not willing to dispense with in-person sessions. VR simulation cannot replace instructor interaction. Medical experts also mentioned the vital role of instructor engagement, expressing that in-person experiences simply cannot be replaced. The apprenticeship model, which offers a blend of observation, experience, and inspiration, is effective not only for knowledge transfer, but for contextual experience and decision-making capabilities that are difficult to be replicated in simulated environments. We suggest future explorations of a hybrid training model, such as remote VR training incorporating real-time instructor feedback. The use of cloud-based technology could alleviate the need for dedicated physical spaces, and the multiplayer login feature could allow instructors to interact with multiple students in a simulated environment. This approach ensures the instructor remains an integral part of the training process. Next, through students' comments and interviews, there is a general consensus that VR simulations provide a degree of visual realism that benefits learning. However, since the students were picking up the instruments using the pinching gesture and following the hand maneuvers in the air, they describe these actions as unnatural, and therefore the lack of tactile realism is likely to have adversely affected the presence and enjoyment ratings in the feasibility questionnaire. To address the gap between interactions in the digital and physical world, the potential of the mixed reality platform becomes evident. The MR platform may be suitable for incorporating tactile elements from the real world into the simulation, thereby offering an enriched sensory experience that better represents real-world tools and procedures. There are inherent limitations in this user study that warrant attention. Firstly, due to time and resource constraints, only basic knowledge was assessed using multiple choice questions. More advanced psychomotor skills, such as the hand maneuvers, were not evaluated after the sessions. Thus, we could not conclude the effectiveness of the design of teaching hand maneuvers in VR. Secondly, long-term retention rates for VR and mannequin training were not evaluated. Thirdly, recruiting volunteers for interviews proved challenging due to the busy schedules of medical students, and the limited number of selected interviewees may not be fully representative for the entire cohort. For our future work, we would love to explore more natural interaction paradigm in VR to make the training more intuitive, conduct more assessments on learning impacts of various factors and durations, and investigate on how to enhance the transfer of psychomotor skills in VR, especially in the context of childbirth delivery. We hope to address the needs of simulation in ONG training and attempt to ensure a smooth integration of the technology into the current curriculum. Thank you very much for your attention.